What about exogenous ketones? So let's say you're trying to work on your diet, but it's still not super perfect, where probably if you tested your insulin levels, they're still a little bit higher. And, in the market now, there's so many exogenous ketones you could take. So then when you test your blood ketones, it is high temporarily. Is that a benefit? What have you seen with the exogenous ketones?
Yeah, so exogenous ketones are really interesting because yes, they do, depending on the type you're using. Yes, they do they can raise ketone levels substantially, particularly the esters. So there are salts, esters, and then there's pure DBHB, purified ketone supplements. And, these are quite expensive and they only last in the bloodstream a maximum of 2 hours. So there are certainly a lot of, limitations to these exogenous ketones, and some of them taste absolutely atrocious. But in any case, they can help bridge that energy gap because they are ketones and they cross the blood-brain barrier and they can serve as a source of energy for brain cells. So it makes sense that they're being explored. They have been explored for cognitive impairment and for dementia. And there are some glimmers of hope there in terms of exogenous ketones. Again, lots of limitations there. But a couple of cautions I would say, really for people who have no other choice, or they're in a say they're in a living situation, they're living in assisted living or in a long-term care facility where they don't have a lot of control over their diet, or their cognitive impairment is already so far along that they really can't manage a dietary change, remember or learn new rules for how to eat. Or let's say they can't, let's say they don't want to change their diet. Um, Exogenous ketones would definitely then be your best option. But again, they're going to be expensive. They
Right.
they only work for a couple of hours, that sort of thing. But the real problem, the biggest limitation with exogenous ketones is that they can't normalize your glucose and insulin levels.
Okay.
So if you are, and that's what's causing the damage in the first place.
Right.
So what you're doing is kind of, adding a kind of expensive Band-Aid
Mhm.
to a situation where the damage is still ongoing underneath. The high glucose and insulin levels are still damaging the brain. It's just that the exogenous ketones are giving you a little bit of symptom relief while that process is marching forward underneath.
Okay, so maybe temporary as a bridge while you're trying to improve your diet, but ultimately you have to, or ideally should be getting natural ketones because that can be an inverse relationship to the reflection of how your insulin is ideally working.
Yes, what I tell my patients and what I tell my clinician trainees, what you ideally want is you want to be generating ketones from inside the body around the clock for free. Because it's only with a ketogenic diet that you are going to be able to normalize your glucose levels, normalize your insulin levels, and generate ketones around the clock for free. And that's really the goal. Now, I realize that not everybody can do that, and I also realize that not everybody is going to be able is going to want to do that. But that is the holy grail of of a good metabolic treatment plan for dementia, where insulin resistance is playing a role.
And then in terms of ketogenic, just to clarify for definition, some people believe that ketogenic diets is as long as you remove carbohydrates and you're not really eating carbohydrates, that's ketogenic. Other people define it as no, you need to eat higher fat to basically stimulate the ketones. Do you measure it based on whatever your ketone reading is? What do you define as ketogenic?
Great. So a ketogenic diet is any way of eating that lowers insulin levels
Okay.
enough to turn on fat burning and generate clinically meaningful levels of ketones in the blood, which most experts would say begins at zero point 0.5 millimole on a blood ketone meter of beta hydroxybutyrate. So that doesn't mean that zero point 0.5 is enough for everybody, but that's where the metabolic magic begins.
Okay.
That's where you have potential for therapeutic results. Now, notice that definition. It does not say anything about carbohydrates. It doesn't say anything about how much carbohydrate there should be in the diet. It doesn't say anything about how much fat there should be in the diet. It says any diet that lowers insulin to the fat burning point. So that could be, there are many different ways to get into ketosis. Fasting will get you into ketosis because nothing drops insulin faster than not eating anything at all. So fasting will get you into ketosis. You don't need to eat any fat if you're no fat required, right? Um, a, a calorie restricted diet a diet that restricts calories to 725 calories per day or lower, even if it contains carbohydrate, a lot of carb, even if it's a high carbohydrate diet, if it's calorie restricted and it's formulated in the right way, that can get you into ketosis too, even though it's a high carbohydrate diet. And so exogenous ketones can get you into ketosis as well, but it's not going to lower your insulin level, so it doesn't meet the definition. So the beauty of a sort of ketogenic diet, as it's generally constructed, is that a ketogenic diet is very low in carbohydrate, because carbohydrate raises insulin the most. It's moderate, adequate in protein, because you must have protein. You must have protein to meet your cellular nutritional requirements. But it's not extra high in protein. It's not excessive in protein, because protein also stimulates an insulin response. And so you don't want to go overboard on protein. And the rest of the calories are from fat. How many of those how much fat, how many calories, really, from the point of view of the ketone meter, doesn't really matter because fat barely raises insulin at all. So you can eat a low-fat ketogenic diet. You can eat a high-fat ketogenic diet. You can eat a medium-fat ketogenic diet. It's not really about how much fat is in the diet. It's about the insulin level. And so the ketogenic diet is the only way to safely maintain ketosis long term. You can't fast forever. You can't calorie restrict forever.
Okay.
The only way you can safely maintain ketosis without starving and without significant hunger and nutritional deficits is a well-formulated ketogenic diet.
Okay. Okay. I was going to ask you, are you okay with the 700 calorie? Because I haven't
No.
seen that in my practice, but I'm glad you just gave that at the very end.
No.
I want to talk about one question about mental health, aside from diet. How much is social media and the isolation stuff happening in the last several years? How much of that impacts our mental wellness?
Well, we're social creatures, right? So we need connection, and not just visual connection or auditory. We need physical connection. We need to be in contact with each other, or in close proximity to each other, to really get all the benefits of social connection. So I do worry about many of us spending most of our time on connecting with people on screens. But I would also say that there is a silver lining to this, where people who live in isolated situations, or like during COVID lockdowns and things like that, or people who live in areas of the world where there just aren't a lot of people, or where they're not going to meet people that they have a lot in common with, so that can also be very dangerous for mental health. People feeling isolated, and that they're not meeting people that they really have a lot in common with or can feel connected to. I think in those ways, social media can be actually very, very useful, because you can find people that you have things in common with and feel connected to, and feel less isolated, less alone. Now, the other really wonderful thing I think about social media and the internet is to help. I mean, as we all know, that it can be a way for ideas to go viral, bad and good ideas both. It's kind of an equal opportunity contagion. I personally am very grateful for the internet, because I can research things much more quickly and learn about ideas, learn science, and gain benefit of other people's perspective much more quickly and easily than back in the 70s, when I was, in school, in grade school and high school, when I had to go to the library, and hopefully there was a book there about
Right.
what I wanted to learn about. We had very limited access to information. We are so much better informed and so much more empowered. And so ideas like carnivore diets, ketogenic diets, paleo diets, metabolic health, all of these really wonderful ideas, which are not coming from mainstream nutrition sources, not coming from our most prestigious institutions, not coming from our most influential scholars on this topic, not coming from our dietary guidelines. These excellent ideas, which are grounded in biology and logic and and anthropology and common sense, this dietary information can spread to people who need it, and that they can compare these ideas to these ideas that they've heard about for so many years, and judge for themselves what makes the most sense to them. And they've got a real choice Whereas before, it was very hard for most of us to access other types of ideas.
No, I think that's great. I agree with you. Information, letting good information win sometimes and getting stuff that's not mainstream be shared. It's so powerful having the internet. And even when I was writing my book, just doing the research was so much easier using PubMed than going to the library and looking at the catalogs and all that. As long as people don't use just the social media aspect and comparing and everyone else's life is better than mine, I think if as long as we remember to think of it as a highlight reel and then find the people that you can connect with genuinely, it actually can do a lot of good. So I totally agree with you. I have some friends that I have met on the internet. Why do you think the medical establishment, you just mentioned that the keto carnivore diets, it's not just from standard care. What is it about the medical establishments, especially in psychiatry, that they're not embracing diet? And I can give you in my world of things of what happened to me personally. I asked my psychiatrist, who I was working with by that time 2 years, I just for some reason asked him, do you think diet has anything to do with why I'm sick? And he looked up and said no. And so I said, okay. And I just sort of moved on. But why is diet not even a focus when if we were to go to the vet, the first thing they ask when the dog or cat is not well is what have they been eating or what have they been exposed to?
Well, I in 4 years of medical school, we didn't talk about brain and nutrition and the brain once. In 4 years of psychiatry of medical school, in 4 years of college biology degree, 4 years of college and medical school, and then 4 years of medical school, 4 years of psychiatry residency, we didn't ever talk about the importance of nutrition to brain health, not once in all of that specialized education. So, of course, psychiatrists come out of their training thinking it doesn't matter because we're not taught that it matters. And the little bit that we do learn about nutrition, which is not about brain health, is about, weight management and cholesterol levels and heart disease, right? And almost all of that information is incorrect. So the very little morsels of nutrition education that we get is misguided. So it makes sense to me that most psychiatrists do not understand how powerful this connection is. But I think the good news is that the science in this field is rapidly exploding. And the word is getting out. And so I think there are some chinks in that armor, and that people are starting to see and hear about on, not just social media, but actually in reputable scientific journals and in reputable media outlets and from reputable sources that these interventions are really revolutionizing. They have the potential to revolutionize mental health care. And then it makes sense, and the biology of it makes sense. And I know this because I've been teaching this CME course in ketogenic diets for mental health for practitioners for more than 4 years now. And we are seeing a really dramatic rise in the interest in this course. People, psychiatrists, psychologists, nurse practitioners, physician assistants, social workers, psychologists, the interest in this field is really growing rapidly, faster than we can keep up with it. And so there's a lot of curiosity, a lot of interest, at least among a subset of practitioners. There will always be, with any new idea, you're going to see a bell curve, right? So you're going to see the early adopters who are really excited about it. And those are obviously the people who are contacting me about the course. And you're going to see the very conservative folks who are really resistant to any new idea of any kind, even if it makes a lot of sense. Their minds are closed. This is a natural human bell curve. But most people are in the middle somewhere where if they saw enough information, they'd be open to it. We're starting to move past this early adopter side of the bell curve. We're starting to see that more and more people in sort of the middle of this bell curve are thinking, wait a minute, what is this metabolic psychiatry? What ketogenic diets for serious mental illness? That's interesting. So we're starting to see more interest in it. And this is really wonderful because mental health practitioners know better than anybody else, we need new interventions. We have run out of ideas for how to help many of our patients. Most of us, I mean, and for myself, I know this is true, and for almost all my colleagues, our practices were filling up with people who just weren't getting that much better. And, medicine after medicine after medicine, years of psychotherapy, in and out of the hospital, with no real tests or explanations or understanding of what was wrong and how to help. And we now have, really just in the past 10 years, these powerful principles, science-based, evidence-based principles that go back over a century now, helping us understand that if you can improve brain metabolism by changing your diet and lifestyle, you can really fundamentally change your brain's operating system. And that gives everybody a tremendous amount of hope, because up until recently, we didn't know what else to do. And now we have these beautiful, empowering, relatively simple, non-toxic, natural interventions that can be life-changing and life-saving in so many cases. So why not explore those?
That's so reassuring. I'm so glad to hear that there's more interest in your program and also just in the medical field in terms of psychiatry.